Imagine walking through a marketplace in ancient Mesopotamia, 4,000 years before our time. The air is thick with the scent of crushed herbs. A healer sits cross-legged on woven mats, grinding minerals into fine powders. Clay tablets surround him, covered in cuneiform script, each one a medical prescription, a recorded observation, a small victory against suffering. We often think of ancient medicine as primitive, as mere superstition dressed in ritual. But if you could read those clay tablets, you'd discover something unexpected. These weren't incantations to angry gods. They were empirical observations, careful records of what worked and what didn't. The Babylonians documented over 250 plant-based remedies, noting specific dosages, preparation methods, and which ailments each addressed. Consider this: around 1750 BCE, the Code of Hammurabi didn't just establish laws for society, it regulated medical practice. Surgeons faced consequences for failed operations, which meant they had to know what they were doing. They couldn't rely solely on prayer. They needed skill, knowledge, anatomical understanding. Archaeological evidence shows Mesopotamian physicians performed remarkably sophisticated procedures. They drained abscesses, set fractures, and even attempted cataract surgery using bronze lancets so delicate they could only be wielded by steady, practiced hands. But let's travel westward now, to the banks of the Nile, where papyrus scrolls hold secrets that would astound even modern physicians. The Edwin Smith Papyrus, dating to around 1600 BCE but copying knowledge from centuries earlier, reads like a trauma surgery manual. It's methodical, almost clinical in its approach. 48 case studies, each one structured the same way: title of the injury, examination procedures, diagnosis, prognosis, and treatment. There's no magic here, no appeals to gods. Just observation. Case 45 describes a dislocated jaw. The treatment: the physician should place his thumbs inside the patient's mouth on the back teeth, his fingers under the chin, and manipulate the jaw back into position. If you've ever witnessed a modern doctor reduce a jaw dislocation, you'd recognize this technique immediately. 3,500 years, and the fundamental approach hasn't changed. The Egyptians understood that the heart was central to life, that pulse indicated health. They recognized the connection between brain injury and paralysis on the opposite side of the body. The Smith Papyrus describes a case of skull fracture where something in his head throbs under your examining fingers, like the weak place in an infant's skull. This is describing a pulsating skull defect, visible brain tissue, something a trauma surgeon today would immediately recognize as requiring urgent intervention. Egyptian physicians specialized. There were dentists who filled cavities with a mixture of ground barley, honey, and ochre. There were ophthalmologists who treated trachoma, still a leading cause of blindness in developing nations. Prosthetics from ancient Egypt show remarkable craftsmanship. A wooden toe, perfectly articulated, found on a mummy, showed where patterns indicating it was actually used during the person's life, not just added for burial. Now, let the Mediterranean breeze carry you across the sea to ancient Greece, where medicine began its transformation from craft to science. Hippocrates, born around 460 BCE on the island of Kos, didn't discover medicine. But he changed how it was taught and practiced. The Hippocratic Corpus, a collection of around 60 texts, established medicine as something separate from religious ritual. Disease wasn't divine punishment. It had natural causes, and therefore natural treatments. The Hippocratic text, on the sacred disease, addresses epilepsy, then believed to be caused by demonic possession. The author writes with barely contained frustration, "It seems to me that the disease called sacred is no more divine than any other. It has a natural cause, just as other diseases have." This was revolutionary thinking. This was the birth of rational medicine. Hippocratic physicians observed carefully. They noted how diseases progressed through stages. They understood that some conditions were seasonal, that environment affected health. They introduced the concept of prognosis, predicting the course of an illness based on observed patterns. This required keeping records, comparing cases, learning from both successes and failures. And the surgeries. Let's talk about what these ancient Greeks accomplished with bronze and iron, without anesthesia beyond wine and opium, without antibiotics. Trepanation, drilling holes into the skull, was practiced with surprising success. Archaeological evidence shows that many patients survived, with bone regrowth indicating healing. They weren't doing this randomly. They were treating head injuries, attempting to relieve pressure from bleeding beneath the skull. Some ancient skulls show multiple trepanations, healed over time, meaning patients survived the first procedure well enough to need a second one years later. Greek physicians performed lithotomies, surgically removing bladder stones. The Hippocratic Oath itself mentions this: "I will not cut for stone, even for patients in whom the disease is manifest. I will leave this operation to be performed by practitioners, specialists in this art." This wasn't a prohibition on surgery, it was acknowledging that some procedures required specialized training, a radical concept for the time. But perhaps the most sophisticated understanding came in their pharmaceutical knowledge. Greek physicians didn't just randomly try plants to see what happened. They developed theories about how different substances affected the body's balance of humors. While the theory itself was incorrect, the systematic approach to testing and refining treatments was sound. Dioscorides, a Greek physician serving in the Roman army around 50 CE, wrote De Materia Medica, a 5-volume encyclopedia describing over 600 plants and their medicinal uses. It remained the primary pharmacological text for 1500 years. And here's what's remarkable: modern pharmacological studies have confirmed the efficacy of many substances Dioscorides recommended. Willow bark for pain relief. We now extract salicylic acid from it, the basis for aspirin. Opium poppy for severe pain, morphine. Foxglove for heart conditions, digitalis. These weren't lucky guesses. They were the result of generations of careful observation. Close your eyes and feel yourself drifting now, back through time, seeing these ancient healers not as primitive shamans but as the first scientists, carefully documenting their discoveries in clay and papyrus and parchment, each one a small light against the darkness of disease and death. The Roman Empire, vast and interconnected, created something unprecedented, a network for sharing medical knowledge across continents. Ideas flowed from Alexandria to Rome, from Damascus to Londinium. And in this crucible of cultures, medicine evolved. Galen of Pergamon, born in 129 CE, stands as a towering figure in medical history. His influence would dominate Western medicine for nearly 1500 years, longer than any other physician in history. But why? What made his work so enduring? Galen was systematic in a way few ancient physicians had been. He dissected animals. Human dissection was largely forbidden in Rome, and extrapolated to human anatomy. Yes, this led to errors. But his methods, his insistence on understanding structure to comprehend function, established a framework for medical thinking. He demonstrated that arteries carried blood, not air as previously believed. He identified 7 pairs of cranial nerves. He distinguished between sensory and motor nerves by cutting them and observing the results. His experiments were sometimes brutal. He vivisected pigs to demonstrate brain function, showing how cutting different parts of the spinal cord caused paralysis in corresponding body parts, but they were experiments, evidence-based approaches to understanding the body. Galen's writings were voluminous. He claimed to have written hundreds of texts, and about 150 survive. They covered everything from anatomy to pharmacology to philosophy of medicine. He believed in careful observation, in combining theoretical knowledge with practical experience. The best physician is also a philosopher, he wrote, arguing that medicine required logical thinking and ethical grounding. But even as Rome declined and Europe entered its so-called Dark Ages, the light of medical knowledge didn't extinguish. It simply moved. The Islamic Golden Age, roughly from the 8th to the 14th centuries, preserved and dramatically expanded medical knowledge. While European medicine stagnated, scholars in Baghdad, Cairo, Cordoba, and Damascus were revolutionizing healthcare. Picture the House of Wisdom in Baghdad, during the 9th century. Scholars from different religions and cultures work side by side, translating Greek and Roman texts into Arabic, adding their own observations, conducting experiments. This wasn't just preservation, it was active advancement. Muhammad ibn Zakaria al-Razi, known in the West as Rhazes, born around 854 CE, embodied this spirit of inquiry. He served as chief physician at Baghdad's main hospital, but he was also a chemist, philosopher, and innovator. His text on smallpox and measles was the first to clearly distinguish between these two diseases, describing their symptoms with such precision that it remained definitive for centuries. Al-Razi pioneered clinical observation. He kept detailed case notes on his patients, tracking their symptoms and responses to treatment. This might seem obvious now, but it wasn't standard practice. He tested theories experimentally. In one famous case, he was asked which location in Baghdad would be best for a new hospital. He hung pieces of raw meat in different neighborhoods and chose the location where the meat decomposed slowest, assuming this indicated healthier air. While his theory about air quality was incomplete, his experimental approach was sound. But perhaps the most influential Islamic physician was Ibn Sina, known in Europe as Avicenna. Born in 980 CE in present-day Uzbekistan, he was a polymath whose medical encyclopedia, the Canon of Medicine, synthesized all known medical knowledge of his time into a systematic, organized text. The Canon wasn't just a compilation. Ibn Sina organized medicine into theoretical and practical branches. He discussed anatomy, physiology, diseases and their symptoms, pharmacology, and treatment. He emphasized the importance of preventive medicine, diet, exercise, sleep, hygiene. He understood that mental and physical health were interconnected. His pharmaceutical knowledge was extraordinary. The Canon describes over 760 drugs, with details on their preparation, dosage, and effects. He established rules for testing new medications that sound remarkably modern. The drug must be pure, tested on multiple patients with the same condition, with sufficient time to observe effects, and compared against known treatments. Ibn Sina also made surgical contributions. He described techniques for suturing wounds, treating bladder stones, and managing difficult childbirths. He understood the importance of sterilization. He recommended using wine or vinegar to clean surgical instruments, not understanding why this helped but observing that it did. Another revolutionary scholar, Ibn al-Nafis, working in the 13th century, discovered pulmonary circulation, how blood flows from the heart to the lungs and back. This was 300 years before European physicians would reach the same conclusion. He challenged Galen's errors about heart anatomy, something European doctors wouldn't dare to do for centuries more. And then there's the concept that might be the Islamic Golden Age's greatest medical legacy, the hospital as we know it. The first true hospital, a place where patients were admitted, treated, and could stay during recovery, was established in Baghdad around 805 CE. By the 10th century, Baghdad had 5 major hospitals. These weren't just larger clinics. They were organized institutions with separate wards for different conditions, medical libraries, lecture halls for teaching, pharmacies, and even gardens where medicinal plants were cultivated. The Al-Mansuri Hospital in Cairo, completed in 1284, could accommodate 8,000 patients. It had separate wards for different diseases and conditions: ophthalmology, surgery, orthopedics, mental health. It had a library containing thousands of manuscripts. Treatment was free regardless of patient wealth, gender, or social status. A recovery ward provided food and clothing to discharged patients who needed support. These hospitals pioneered the teaching hospital model. Senior physicians conducted rounds with students, discussing cases and demonstrating treatments. Medical licensing became formal. Physicians had to pass examinations proving their competence. This wasn't just about protecting patients, it elevated medicine from a craft to a respected profession requiring demonstrated knowledge. The hospital in Damascus appointed its first chief of staff in 1160. The contract required him to attend patients daily, teach medical students, and oversee the pharmacy. This organizational structure, specialized roles, professional standards, educational mission, established patterns that persist in hospitals today. Let your mind rest now on this image, a hospital ward in 13th century Cairo, sunlight streaming through geometric latticed windows, the air scented with rose water used to calm patients, physicians in clean robes discussing a difficult case while students listen and learn, scribes recording treatments and outcomes for future reference. This was healthcare becoming systematic, knowledge becoming institutional, healing becoming a science. Europe awoke slowly from its medieval slumber, and when it did, medicine underwent a dramatic transformation. But this awakening required someone willing to challenge 1,500 years of unquestioned authority. Andreas Vesalius, born in Brussels in 1514, was the right person at the right time. As a young anatomy professor at the University of Padua, he did something shocking. He performed human dissections himself, rather than reading from Galen's texts while a barber surgeon did the cutting, as was traditional. And what he found troubled him deeply. Galen was wrong. Not about everything, but about crucial anatomical details. The human jaw was one bone, not two. The liver didn't have 5 lobes. The heart's septum wasn't porous. These weren't minor errors, they were fundamental misunderstandings based on Galen's animal dissections. In 1543, Vesalius published De Humani Corporis Fabrica, on the fabric of the human body, with exquisitely detailed illustrations. The book was revolutionary not just for correcting Galen, but for establishing observation over authority. Vesalius essentially said, "Don't believe something because an ancient text claims it. Look for yourself." This was dangerous thinking. The medical establishment was furious. Vesalius's former teacher publicly denounced him. He received death threats. But the evidence was there, in the bodies, undeniable to anyone willing to look. The detailed illustrations in the Fabrica transformed medical education. For the first time, students could study accurate representations of human anatomy without access to cadavers. The drawings showed muscles layer by layer, organs in their precise locations, blood vessels branching like rivers on a map. Medicine could no longer ignore what the body actually looked like. But anatomy was just the beginning. The 17th century brought another revolution, this time in scale. Antony van Leeuwenhoek, a Dutch merchant with no formal scientific training, ground lenses as a hobby. By the 1670s, his microscopes could magnify objects up to 275 times, far more powerful than any existing microscope. And he looked at everything, water from ponds, his own dental plaque, blood, semen, tissue samples. What he saw astounded him. An entire world of animalcules, tiny creatures invisible to the naked eye, swimming, moving, living. He described bacteria with remarkable accuracy, calling them little animals of various shapes. He saw red blood cells, the first person in history to observe them. He discovered protists and microscopic parasites. Van Leeuwenhoek's letters to the Royal Society of London, over 300 of them, detailed his observations with childlike wonder but meticulous precision. He measured these creatures, 1,000 times smaller than a grain of sand, he estimated, trying to convey their impossible teeniness. But here's what's fascinating, even after seeing bacteria, even after observing that stagnant water teemed with microorganisms, even after finding these little animals in infected wounds, neither van Leeuwenhoek nor most scientists for the next 200 years connected them to disease. The idea was too radical. Disease, everyone knew, came from bad air, miasma. It arose from rotting organic matter, swamps, sewers, corpses. The theory made sense. After all, disease did seem to cluster around filthy conditions. What they didn't understand was that those conditions harbored microorganisms, not mystical bad vapors. The miasma theory drove some good outcomes. If disease came from foul air, then cleanliness helped. Cities improved sanitation, drained swamps, removed waste more efficiently. But it also led medicine astray in crucial ways. Ignaz Semmelweis discovered this tragically. In the 1840s, working in a Vienna maternity ward, he noticed something disturbing. Women who delivered with doctors and medical students had much higher rates of childbed fever than women who delivered with midwives. Why? Semmelweis observed that doctors often came directly from autopsy rooms to delivery rooms. Perhaps they carried something on their hands. He instituted a simple rule: wash hands in chlorinated lime solution before examining patients. Mortality rates plummeted from 18% to less than 2%. But when Semmelweis published his findings, the medical establishment rejected them. The idea that doctors, gentlemen, could be carrying death on their hands was offensive. The miasma theory couldn't explain Semmelweis's observations, so instead of questioning the theory, physicians questioned Semmelweis. He died in an asylum, his discovery unrecognized. But the evidence accumulated inexorably. John Snow, during London's 1854 cholera outbreak, mapped cases and traced them to a single contaminated water pump on Broad Street. He didn't know about bacteria, germ theory hadn't been established yet, but he proved cholera spread through water, not air. Louis Pasteur provided the crucial evidence in the 1860s. Through elegant experiments, he demonstrated that microorganisms caused fermentation and spoilage. He showed that sterilizing liquids prevented contamination. He proved spontaneous generation, life arising from non-life, was a myth. Microorganisms came from other microorganisms, and they could be killed by heat. The implications for medicine were profound. If microorganisms caused fermentation and spoilage, might they also cause disease? Robert Koch answered this question definitively. In 1876, he isolated Bacillus anthracis from diseased animals, cultured it, infected healthy animals with the culture, and recovered the same bacteria from the newly diseased animals. He'd proven a specific microorganism caused a specific disease. He later identified the bacteria responsible for tuberculosis and cholera. Germ theory revolutionized medicine more dramatically than any discovery before or since. Suddenly, disease wasn't mysterious. It had specific causes that could be studied, prevented, and potentially treated. Cleanliness wasn't just aesthetically pleasing, it was life-saving. Surgery could be antiseptic. Water could be purified. Specific diseases could be traced to specific pathogens. Joseph Lister, reading Pasteur's work, applied antiseptic principles to surgery in the 1860s. He used carbolic acid to sterilize instruments and wounds. Surgical mortality rates dropped dramatically. Operations that would have been too dangerous became possible. Think about this transformation. In 1850, a surgeon might perform an amputation in his street clothes, without washing his hands, using instruments cleaned only by wiping them on his apron between patients. By 1890, the same surgery would be performed in a sterilized operating theater, by surgeons in clean gowns with washed hands, using sterilized instruments. The mortality rate difference was the difference between almost certain death and probable survival. Let yourself drift now on this current of discovery, feeling the acceleration of knowledge, seeing medicine transform from guesswork to science, from superstition to understanding, each generation building on the last, each discovery illuminating new questions, the path winding forward through time toward the medicine we know today. There's a reason barbershops once displayed red and white striped poles. Those colors represented blood and bandages, because barbers weren't just cutting hair, they were the surgeons of medieval Europe. Before formal medical education, healing was learned through apprenticeship. A boy would attach himself to a physician or surgeon, watching, assisting, gradually taking on simple tasks, then more complex ones. Knowledge passed orally, through demonstration, through trial and error. There were no textbooks for most people, no standardized curriculum, no examinations. The first medical schools emerged in the medieval Islamic world and in European cities like Salerno and Bologna. The University of Bologna, founded in 1088, established formal medical training in the 12th century. Students studied for years, learning anatomy, theory, the works of ancient authorities. But practical training was minimal. You could graduate as a physician without ever having touched a patient. This created a strange hierarchy. Physicians, university-educated, versed in theory, were gentlemen who diagnosed and prescribed. Surgeons, trained through apprenticeship, were craftsmen who cut, set bones, and extracted teeth. Barber surgeons occupied the lowest tier, performing bloodletting, minor procedures, and dental extractions. A physician wouldn't dream of performing surgery, it was beneath his status. This division persisted for centuries, to medicine's detriment. Theory divorced from practice, practice divorced from understanding, neither was sufficient alone. The transformation began gradually. Vesalius, teaching anatomy at Padua, performed dissections himself and required his students to observe closely. This was revolutionary. Anatomy became something you learned by doing, by seeing, not just by reading. By the 18th century, medical education was expanding beyond ancient texts. Hermann Boerhaave in Leiden taught at the bedside, bringing students to hospital wards to observe patients directly. He emphasized clinical observation, careful documentation of symptoms, progression, and outcomes. He performed autopsies to understand what had gone wrong, correlating symptoms with physical findings. This clinical approach spread. Edinburgh, following Leiden's model, became a premier medical school. Students learned anatomy through dissection, observed surgical procedures, and studied real cases. Edinburgh graduates, in turn, established medical schools in North America following similar principles. But a fundamental problem remained: most medical education was theoretical. Even clinical training consisted mostly of observation. Students might graduate having never examined a patient independently or made a diagnosis without supervision. William Osler changed this. Appointed to Johns Hopkins Hospital in 1889, he revolutionized medical education with a simple principle: students should learn on the wards, working directly with patients under supervision. His residency system meant graduates weren't turned loose immediately but continued training with increasing responsibility. Osler emphasized the importance of the patient's story, careful history-taking, listening, understanding the full context of illness. He taught physical examination as a skill requiring practice and refinement. He brought medical education out of lecture halls and into hospital wards where learning happened at the bedside. The Flexner Report of 1910 accelerated this transformation in American medicine. Abraham Flexner visited every medical school in the United States and Canada, and his findings were damning. Many schools were proprietary operations with no admission standards, minimal facilities, and no hospital affiliations. Students received poor education and entered practice dangerously unprepared. Flexner's recommendations: medical schools should require prior college education, provide laboratory facilities, offer clinical training in hospitals, and be affiliated with universities, transformed medical education. Poor quality schools closed. Standards rose. Medicine became a true profession requiring demonstrated competence. But education alone wasn't sufficient. Medicine needed to become more than accumulated experience and authority. It needed systematic evaluation of treatments. The first controlled clinical trial occurred in 1747, though no one called it that at the time. James Lind, a Scottish naval surgeon, noticed that scurvy devastated ships' crews on long voyages. Various treatments were proposed, everything from vinegar to seawater to citrus fruit. But which worked? Lind took 12 sailors with scurvy and divided them into 6 pairs. Each pair received a different treatment. The 2 sailors given oranges and lemons recovered. The others didn't. This was evidence-based medicine in its infancy, comparing treatment systematically rather than relying on theory or authority. But Lind's approach wasn't widely adopted. For nearly 2 centuries, medical treatments were chosen based on tradition, theory, or the physician's personal experience. Bleeding, purging, and toxic medications remained standard despite little evidence of benefit and much evidence of harm. The transformation to evidence-based medicine accelerated in the 20th century. Randomized controlled trials, randomly assigning patients to treatment or control groups to eliminate bias, became the gold standard for evaluating therapies. The Cochrane collaboration, founded in 1993, began systematically reviewing medical evidence to guide practice. Modern medicine now demands proof. New drugs must undergo rigorous testing, laboratory studies, animal trials, then human trials progressing through phases, each larger and more rigorous than the last. Treatments are evaluated not by testimonials but by statistics, measured outcomes, reproducible results. Public health emerged from this same evidence-based revolution. John Snow's discovery that cholera spread through contaminated water led to water treatment systems. Pasteur's germ theory justified sanitation improvements. The connection between mosquitoes and malaria, between rats and plague, between hygiene and infant mortality, each discovery translated into public health measures that saved millions of lives. Edward Jenner's smallpox vaccine, developed in 1796, was medicine's first successful vaccine, based on the observation that milkmaids who contracted cowpox seemed immune to smallpox. The principle, exposing people to weakened or related pathogens to build immunity, was revolutionary. But smallpox vaccination didn't become widespread until governments instituted public health campaigns making it compulsory. These campaigns faced resistance. People objected to government mandating medical procedures. They didn't understand how vaccines worked. Some religious groups opposed them on principle. But the evidence was undeniable. Vaccinated populations didn't suffer smallpox outbreaks. Unvaccinated populations did. Public health measures, clean water, sewage systems, food safety regulations, workplace protections, vaccination campaigns, have saved more lives than all of clinical medicine combined. Life expectancy in 1900 was about 50 years. By 2000, it exceeded 75. Most of that increase came not from better treatment of disease but from preventing disease through public health. Feel yourself settling deeper now, your breathing slow and regular, thinking about this long arc of progress, from apprenticed healers to educated physicians, from bleeding patients to healing them, from tradition to evidence, from treating the sick to preventing sickness, each generation learning from the last, building on their discoveries, the accumulated knowledge of thousands of years of human experience with suffering and healing. In a laboratory in Shanghai, researchers carefully extract compounds from sweet wormwood, Artemisia annua, a plant used in traditional Chinese medicine for over 2,000 years to treat fevers. The active compound, artemisinin, becomes the most effective treatment for malaria, saving millions of lives. The discoverer, Tu Youyou, receives the Nobel Prize in 2015. This isn't isolated. Modern medicine increasingly looks backward, re-examining ancient remedies with modern scientific tools. Bioprospecting, systematically investigating traditional medicines for active compounds, has yielded remarkable discoveries. The Pacific yew tree, used by Native Americans for various ailments, contains paclitaxel, now a crucial chemotherapy drug. The rosy periwinkle from Madagascar, used in traditional medicine, provides vinblastine and vincristine for treating leukemia and lymphoma. Aspirin, perhaps the world's most widely used drug, derives from willow bark, used for pain relief since ancient times. Digoxin for heart failure comes from foxglove. Morphine from poppies. Quinine from cinchona bark. The list extends across hundreds of medications. But here's what's fascinating, we're not just validating ancient knowledge. We're understanding why it worked. Modern pharmacology can identify active compounds, understand their mechanisms, refine them, synthesize them, improve upon them. Ancient healers knew willow bark reduced pain. We extracted salicylic acid, modified it to create aspirin, developed better formulations, understood how it works, and created related compounds for specific purposes. The World Health Organization estimates that 80% of people in developing nations rely primarily on traditional medicine. This isn't just because modern medicine is unavailable, though that's part of it. It's also because traditional medicine offers something valuable, accumulated empirical knowledge about local plants, tested across generations. Traditional Chinese medicine uses thousands of plants, minerals, and animal products. Many have no proven efficacy, but some do. The challenge is separating wheat from chaff, investigating systematically rather than dismissing wholesale or accepting uncritically. The National Institutes of Health established the National Center for Complementary and Integrative Health specifically to study these questions scientifically. Does acupuncture relieve pain? Evidence suggests it can, for certain conditions, though perhaps not through the meridian system traditionally described. Do meditation and yoga improve health outcomes? Studies show benefits for stress, blood pressure, chronic pain, measurable, reproducible benefits. This represents a shift in how medicine thinks about healing. The 20th century focused intensely on reductionism, breaking problems into smaller parts, finding specific causes, developing targeted treatments. This approach succeeded brilliantly against many diseases. We can cure bacterial infections, perform organ transplants, replace joints, remove tumors with precision. But some conditions resist this approach. Chronic pain, autoimmune diseases, mental health conditions, functional disorders, these often involve complex interactions between genetics, environment, stress, behavior, and physiology. Treating one factor isn't sufficient. Ancient medicine took a more holistic view. Traditional Chinese medicine considers overall balance. Ayurvedic medicine treats mind and body as interconnected. Hippocratic medicine emphasized lifestyle, environment, mental state alongside physical symptoms. Modern integrative medicine attempts to combine both approaches, rigorous scientific methods applied to whole-person care. This means using proven conventional treatments while also addressing stress, diet, sleep, exercise, social support, and yes, evidence-based complementary therapies when appropriate. Consider chronic pain. Modern medicine offers powerful painkillers, nerve blocks, even surgical interventions. But research increasingly shows that the most effective approach combines multiple strategies: medication, physical therapy, cognitive behavioral therapy, sometimes acupuncture, or meditation, attention to sleep and stress management. This isn't rejecting modern medicine, it's recognizing that pain is complex, involving not just damaged tissue but also nervous system sensitization, psychological factors, and lifestyle. Or consider the microbiome, the trillions of bacteria living in and on our bodies. Modern science discovered it recently, but traditional medicine always emphasized digestion's importance to overall health. Hippocrates supposedly said, "All disease begins in the gut." He was wrong, not all disease begins there, but modern research shows the gut microbiome influences immunity, inflammation, even mood and cognition. Fermented foods appear in traditional diets worldwide: yogurt, kimchi, sauerkraut, kefir, miso. These weren't just preservation methods. They introduced beneficial bacteria, supporting digestive health in ways traditional cultures recognized without understanding the mechanism. Personalized medicine represents another area where ancient insights hint at future directions. Greek physicians described 4 temperaments: sanguine, choleric, melancholic, phlegmatic, supposedly based on humoral balance. The theory was wrong, but the observation that people respond differently to illness and treatment was correct. Modern genomic medicine reveals why. Genetic variations affect how people metabolize drugs, respond to treatments, develop diseases. The same medication at the same dose can be ineffective for one person, therapeutic for another, toxic for a third, because of genetic differences in drug metabolism. Pharmacogenomics, tailoring drug choice and dosage to individual genetic profiles, is medicine's frontier. Cancer treatment increasingly uses genomic profiling, identifying specific mutations and targeting them with specific therapies. This is personalized medicine at a molecular level, but it echoes an ancient recognition: individuals differ, and treatment should account for those differences. Traditional healers also emphasized prevention, maintaining health rather than just treating disease. This, too, is finding renewed emphasis. Modern medicine excels at treating acute illness but struggles with chronic diseases driven by lifestyle, diabetes, heart disease, many cancers. Prevention requires the very things ancient medicine emphasized: appropriate diet, physical activity, adequate sleep, stress management, social connection, sense of purpose. These aren't exciting. There's no miracle pill. But epidemiological evidence overwhelmingly shows that lifestyle factors determine health outcomes more than genetics or access to high-tech treatment. The blue zones, regions where people live unusually long, healthy lives, don't have exceptional healthcare. They have strong communities, plant-based diets, regular physical activity integrated into daily life, low stress, and strong social connections. The oldest interventions are still the most effective. Let your mind rest now on this convergence: ancient wisdom and modern science, traditional knowledge and cutting-edge research, holistic understanding and reductionist precision, all spiraling together, each approach strengthening the other, creating medicine that is at once more scientific and more human, more precise and more whole, more technical and more compassionate. Sleep now, and dream of all those healers across the centuries: the Egyptian physician carefully recording symptoms, the Greek surgeon steadying his hand for a difficult operation, the Islamic scholar copying medical texts by candlelight, the Renaissance anatomist discovering truth through careful observation, the modern researcher investigating ancient remedies with molecular tools. They're all connected, a chain of knowledge stretching from the distant past into the present and forward into the future, each one building on those who came before, each one adding their small part to humanity's long struggle against suffering. Sleep, and know that this work continues, this patient accumulation of knowledge, this gradual lighting of darkness, this endless human endeavor to heal, to help, to understand, to preserve life and reduce suffering. The ancient healer grinding herbs in Mesopotamia, the modern physician prescribing medications based on genetic tests, separated by 4,000 years, united by the same fundamental mission, to ease pain, to cure when possible, to comfort always, to push back against the darkness, one patient at a time, one discovery at a time, one small victory at a time. Rest now. The story of healing is long, and there is always tomorrow for new chapters, new discoveries, new understanding. Sleep peacefully, knowing that the work continues, the knowledge grows, the light spreads, and healing hands reach across the millennia, connecting past to present to future in an unbroken chain of care. Good night.